Yeah, I just saw you just looked down because like.
I don't know.
Yeah, no, it's just I'm being filmed. Yeah, it's if
So I can fill you in on what's going on right now. So I haven't been able to appropriately dialyze since Friday, and actually Fridays I had complications. And so today is Tuesday? Yeah, today's Tuesday, and I'm here now at Dr. Fallis's office to see if I may need surgery to reposition the catheter that's in my abdomen. And so yesterday I went to Cedars-Sinai. They did some x-rays, and from what I heard this morning from the nurse, the catheter is now positioned upward in a northern position somewhere between my chest and my belly button, and it should be in the lower southern region of my body and inside my peritoneal cavity, near like the scrotum area, I guess is what you would say. And the purpose is so that it drains at the lowest level any of the fluid in my body.
So how did it get out of place?
Don't know yet. I get to talk to Dr. Fallis about that. I've had this surgery, the one that I might have, we're going to talk about today. I've had it just as recent as February, and that was due in part to me doing jiu-jitsu and whatnot. I repositioned it while I was doing that. So
just so we can be clear on dates, right now is August of 2010.
Right.
So you mean 8 months ago, February of 2010 also?
Right, yes.
Yeah.
I had a surgery to reposition this particular catheter, and during that surgery I was told they had tethered it down so that it wouldn't move again. So now that I'm in this position, I get to ask the doctor, like, how is it that it moved, and is that common, or what's going on? Because I haven't really been doing anything. I cut the jiu-jitsu out, so it's not that. And I've been all I've been doing recently is training up for the bike ride. So I've just been bike riding and working out the way I've always been working out, lifting weights and doing some cardio here and there. So
do you feel like having to do the dialysis has made you weaker or kept you from being able to work out at full strength?
It hasn't kept me from doing anything, but it's definitely a challenge and an obstacle that that I get to work with everything that I'm doing. The problem that I've had recently is I've been successfully training, and then this little hiccup has set me back from training. So,
right.
So yeah, I want to hurry up and get whatever we need to do out of the way so I can get back and train, because the bike ride's October the 3rd. So.
How long ago was it that you first had to go on dialysis? That they first put the tube in?
That was December of 2008 is when I had the surgery, and then I wasn't able to use it until January of 2009. I had to let it heal and everything. So, yeah.
So, would it be all right if we saw the tube?
Oh yeah. So here's the catheter. There's the site. And this is what I used to hook up to the machine. Just replace that cap and undo it here, and then the machine, the fluid comes in and drains out.
So how long do you have to do that for every day?
If everything flows right, it's about 8 to 9 hours. Sometimes there's drainage issues or filling issues. It can extend my dialysis for a couple minutes to maybe a whole hour longer. So, yeah, anywhere from 8 to 10 hours.
Wow. And you do that during your sleep cycle?
Yeah, I've set it up so that I do it at night when I sleep.
Hello there.
Hey, Dr. Fellis.
What's going on? Not working?
Not working.
Since when? Since ever or no?
No. Friday was the last day that I dialyzed.
Yeah.
And even on Friday I was having some complications.
Okay.
And
it was infusing but not draining?
Right, yeah, and even the infusion was slow.
Okay.
So
the infusion was slow.
Yeah, it would slowly fill, and I think, I haven't been able to drain out any of the fluid I put in. I thought maybe something was in there, so I put in more fluid and it just didn't come out.
And this is already, when did we put this in?
The original date that we put it in was December of 2008.
And then?
And then I I was doing some jujitsu stuff and I repositioned it, and I had to come back in February, and we did a surgery just recent as February, and I think you said you had tethered it this time so it wouldn't move, but
Okay.
here I am.
So the original catheter back in '08 was working till February, and then I scoped you in February and repositioned it. It's been
Right.
working from February till now.
Till now, yeah.
6 months.
Yes, it's been working fine, and the only thing I have been doing is I've been doing a lot of bike riding.
Kind of take a look inside.
Yeah?
I mean, if it's not working,
All right, all right.
let's take a look. Let me out.
Sure.
Okay.
All right. I'm sorry, I wanted to let you know, that's my friend Tony. I'm just doing this documentary because I'm going to be doing this veterans ride,
Sure.
this bike ride.
Sure.
That's what I've been training up for.
Sure.
And I just kind of wanted to chronicle everything.
Absolutely. Okay, well, this all looks fine. Looks like a little scab there.
Yeah, it crusts a lot.
The crust up there?
Yeah.
That's fine, okay. All right, so if it's not, and you haven't been able to use this since Friday?
Since
And
Friday.
today's Tuesday. Have you
Yes.
tried it again or no? You just
I tried it last night and it
Nothing
wouldn't
again.
nothing.
Okay. All right.
And Kenny was saying he saw the x-rays and that it is in a northern position.
Yeah, so it must have dislodged and gone north.
Flipped up, yeah.
Yeah, it's over here supposedly.
Yeah, supposedly it's over here.
All right, so I'm just gonna make a decision, put a scope in, and this time I'll probably suit, if I am gonna reposition it, I don't think I used a permanent suture last time.
Okay.
I used a suture that I thought would just fix it and then, it would
Let
scar
it
in.
stay there, yeah.
Yeah, but this time I'm gonna have to use a permanent suture, they'll just keep it there.
Okay.
But no reason for you not to, to lose a good catheter, so let's take a fix at it.
Yeah, no,
Okay.
for sure.
Cool.
The other thing I wanted to ask you is, what was I gonna say? I can't remember. It'll come to me. It'll come to me.
Okay, good. So otherwise you're doing well?
Yeah, otherwise, yeah, after that first surgery, everything worked out well.
Okay.
One of the things is after that first surgery, I think we tried to do a fill too soon. And I don't know if they told you about that.
You leaked.
It leaked into my, it was all,
I heard.
I was like, and I was telling the guy, maybe we should wait a little bit, but.
Okay. So this time I'll wait 2, 3, 4 days till.
Yeah, two days would probably be good.
All right.
Alright.
So come talk to Marcy and we'll get you scheduled.
Okay, great. How soon do you think we can?
I don't know, as soon as we can.
Okay, great.
This
Thank
week.
you, Dr. Fellows.
Doctor, I really appreciate you letting me here. Would you mind if we use this footage? This is really great footage for our documentary.
No.
Thank you so much. Sure.
Thanks, Dr. Fellows.
So, Alex, so what you have to do now is schedule another appointment for them to come in and cut open your stomach.
Yeah, and then just do the repositioning. So let me talk to Marcy about scheduling a
Okay.
date for that.
Do you mind if I follow you?
No, not at all.
Do you have a certain day you want to do it, or just as soon as
You
possible?
gotta get labs though from, who's Copeland takes care of you, right?
Yes, Dr. Copeland.
So you have to go to Stephen for labs before, because any patient with a history of renal failure, the anesthesiologist, unless they have a recent potassium, they won't put you to sleep.
Oh, okay. All right.
So you're gonna go back to Dr. Copeland today? You want me to try to get it tomorrow, get it for tomorrow even, or next day, or what's
Yeah,
the
yeah,
thing?
we can do it for tomorrow. We'll get it
Okay.
done. And since I'm down here, I'll go right
Yeah,
to
just
Dr.
go. What's the
Copeland's
best,
office.
yeah, I can't, because Kenny could draw them,
Oh,
or
Kenny
Dr.
can do it?
Copeland, anybody could draw labs,
Oh, okay.
yeah.
Let me I'll just go
Yeah,
to see
Kenny
this
might
one.
be quicker to do it. What's
Yeah.
the best phone number to call you at?
626
Uh-huh,
393
uh-huh.
3758.
Okay, I'm gonna call you as soon as I hear from Cedars, okay?
Okay, perfect. And I'm gonna give
If I don't
Kenny a
call you
call.
today, I'll call you tomorrow. If I don't.
How recent does the blood work have to be?
Within a week.
Within a week? Okay. All right, I'll talk to you.
This
Thanks,
is all
Dr.
the
Fellows.
info- This is, you probably don't need it, but this is all you need for scheduling at Cedars. Okay?
Oh, for anyone?
Yeah, it's just general instructions for scheduling, so you have it. Where to go, what time to get there, everything, but.
No, is this for the blood or is this for the surgery?
No, that's for surgery.
Okay.
That's, yeah, just to tell you what you need for surgery, but I know you've been there before, so you're
Yeah.
probably used to it.
Okay.
Okay.
I'm gonna call Kenny now then and see if he can do
Yeah,
some
and
blood
tell him
work.
we just need routine labs.
Routine labs, and then who
Yeah.
does he need to send it to?
To our office, and here's a card.
Okay.
I think he has the fax number, but just in case.
All right.
Okay.
Sounds good. Thank you so
And
much.
Take care.
Ma'am, I apologize for the camera, but we're making a documentary about him trying to do this bike ride. Would you mind if we...
Making a documentary about what?
Well, him dealing with his sickness, and then he's training for this bike ride as well. Do you mind if we use this footage?
No, I don't mind.
Okay.
Oh, wow. You're training for a bike ride?
Yeah, I'm going to do a veterans bike ride for
cool.
disabled vets. So this is just part of the
Are you
drama.
a vet? You're
Yes, I am.
Oh, wow. Good for you.
Yeah, so
I'm glad and
Oh, yeah.
That's good. That's good.
you like that?
I like that. Good luck to you. When is the bike ride?
It's October the 3rd to October the 9th. It's we're riding from the VA in San Francisco down to the VA over here in West LA.
Good for you.
So it's going to raise money for guys with missing limbs.
Good, because I know the VA is not doing everything they can.
Yeah, yeah.
I mean, I know that's a touchy subject, but they need to do more.
Yeah.
You guys went over there and...
No kidding.
And
Hopefully,
everything.
this documentary will kind of light a fire under their butt.
I hope so. Well,
Cool.
good luck.
All right.
Okay.
Thank you.
Well,
We'll see ya.
No, what was your name?
Okay.
I'm Marcy.
Thanks so much, Marcy.
Sure.
Take care.
You got it, bud?
How you doing, Christian? Yeah, I don't have your express oral consent to put...
Christian? Yeah, Christian's not going to give you his consent.